classes as our initial intake. Visit, we do them twice a week. Monday lunchtime, Tuesday night. Mark delivers them, and I am present in the room, I would say, over the last 13 months at 95% of them. And so it varies between having 3 people there to most of the time it's a dozen to 20 people. On Tuesday night we had 24 people in the room, including Sam, Gabby and I, so I guess 21 members of the public, and Sam and Gabby's children and one other child. So the room was full. The class was a good class. The guy in question had been involved in, there's a point at which Mark is demonstrating how simple it is to impact the spine, and as an example, putting your wallet in your back pocket. And this guy had his wallet in his back pocket, so Mark said take it out. And so he was active within the class about 5 minutes before this occurred. It's about 45 minutes into the class, which Mark's talking about the examples of people with conditions other than mechanistic, symptom-based conditions that have improved through chiropractic care in this office. And this gentleman's wife suddenly became very audibly and visibly and kinesthetically, the word I would use is panicked. She was very, very anxious. She was calling the guy's name. She was on the verge of tears, I would say. And obviously we all looked over, and this guy was basically grey, sitting like this. He looked about 79 to me, and was very obviously not in a good way. Everyone around him started kind of
to the point where we didn't know it was his wife, we thought it was his daughter.
Yes.
Okay?
Yeah. That's it. Yeah, that is relevant. And the people around him were kind of calling his name, shaking him. There was a what I would describe as a concerted effort to arouse him had he just been asleep, because we've had people nod off in the class before, of the older generation, and it became very clear that he was not coming around, not just to me but to everybody in the room, and at least a third of the room got up and ran out, like literally ran out. I thought the guy was dead or dying, and I am confident in saying that I think most of the people in the room, if not all of them, thought the same thing. I'm not particularly proud to say I basically sat there and waited for Mark to do something. He was the only person that kind of leapt into action. I don't know if you ran over to him or certainly moved pretty quickly. Everyone around him had kind of scattered, so Mark ended up kind of standing behind the guy because the lady with him was next to him. And you spoke to him, tried to kind of rouse him, and then I remember you lifting his head up, and nothing really changed. And I also remember seeing your hands on his neck, and I've thought about this obviously a lot over the last few days, and I also remember very clearly thinking, yes, you should adjust it. And then you, I thought, delivered an adjustment, but it was very, very, very gentle and subtle. And then the guy, almost like that, was awake. And within probably 30 seconds, able to actually hold a conversation. In the meantime, someone else in the room had phoned the ambulance, and so the guy was sort of conscious enough to actually answer questions that the ambulance people were over the phone were like, they asked him what his name was and stuff like that. So he was, you know, totally kind of, maybe not totally, but was aware enough to have that conversation. There was a massive sense of relief in the room, from us included. And then the ambulance guys basically said, well, we've, you know, based on what's happened, we've still got to come. They came and tested his vitals and all that sort of jazz. And one of the questions they asked him was how old he was, and he said he was 49, which I thought, maybe I'm not as good at Spanish as I thought I was, because that can't be right. Like, I genuinely thought I must have heard that wrong. And then they decided, based on the events, take him into hospital. And then Mark had to come back into the room and finish the class, which, you know, like, I hold my hands up to you for that. Jeez. I have to say, it wasn't the best close he's ever done. But I did say to him the next day, maybe it's worth, because obviously some of the people that come to the class don't have their first visit appointment yet, and I said maybe it's worth calling those people, because, you know, normally we leave a sign-up sheet out, and you didn't mention that. And he said, no, people signed up on the way out. I was like, wow. And so, in terms of the criticism that we've that's been kind of levelled on us, the first thing I would say is, I don't think it was irresponsible not to perform CPR. You obviously checked his pulse. That's one thing I did forget to mention, that you said he didn't have a pulse. Yeah, you obviously checked his pulse. By lifting his head, you opened his airway. Had you delivered an adjustment and nothing had changed, we could then have still done CPR after that. All you'd lost is 10 seconds. I don't think that's, like, it would have taken that amount of time to get him in a reasonable position to do it anyway. Had he been my father and you had done exactly the same thing and the outcome had not been positive, I would not have held you responsible for that. And I guess that's the simplest way I can say that I think the way you acted was appropriate. The fact that it's been described as a possible sham or staged or as a practice grow or whatever is, to me, is laughable. Like, why would, like, yeah, I mean, it's not even worth responding to. But the one thing I know is the way the lady that was with him behaved. Nobody is that good an actress. Meryl Streep on her best day could not have been the way she was. And the last thing I would say is that I'm pretty sure nobody in the room other than Sam, Gabby and I and Mark know that you adjusted his neck. Because it wasn't like none of those people have been to have been adjusted here before. Maybe one or two are patients that were bringing someone with them, and it certainly wasn't publicised in the room afterwards. Like, oh wow, did you see that guy come around after I adjusted him? So it just wasn't that kind of event. So it was very shocking. It was very humbling. It was retrospectively very. I am more excited about adjusting people now and the impact that can have than I was before. But equally, I wouldn't say I've been shocked, but it has been a real eye-opener to me, the backlash that it's received, and so how vehement and how desperate the other group of chiropractors are for us to not be in existence. Not just for them to be more powerful than us or for us to be unsuccessful, but for us to literally no longer exist. The vehemence and the aggressiveness of that has surprised me. Like, I knew obviously that there was that clash, but yeah, it's been beyond what I thought. You know, so I don't think it is enough to just quietly go about your business doing what you do and hoping people are going to leave you alone, because they are not.
I would like to add, unconscious event in my eyes, and that's why I think it received so much backlash, because we can't describe it. And it was fascinating to be a part of. I saw Mark go behind the guy. Mark felt the gentleman's pulse. Mark's face went white with, oh my gosh, this guy is dead. And then Mark's energy changed into feeling and doing whatever he did, delivered the adjustment in an energetic way. And as Robert explained, straight away his eyes were doing this in the back of his head basically, and then opened his eyes and was totally coherent. So it was fascinating to be a part of. Full stop.
Was the guy aware what happened to him?
He said afterwards he felt dizzy, and then he beforehand, and then he didn't remember, right?
So no.
I mean, I didn't.
He was embarrassed.
Yeah, and she was embarrassed for, like, they were embarrassed about disrupting the class.
And they came in. She came in yesterday.
She came in yesterday as a new patient.
Yeah.
What about him?
He was just there at the class to accompany her. We'll get him in.
Yeah.
And the other thing is I called, so after it's over, right, I'm driving someone home, and I called Rob on the phone. I'm like, what just happened? And he, like, tell me what you think happened.
Were you aware? What
I'll tell you in a second. You on anything yet? Or?
Yeah, I think from my point of view it was maybe a little bit different again, because I was in a different part of the room to Rob. Rob was at the back behind, and I was sitting in front of the guy, so I didn't even know it was the guy who had given you his wallet. I hadn't seen him before. I had no idea until it was all, you know, until his wife started getting everybody's attention. And moments before that happened, we could, you know, the energy changed and everybody heard this lady start talking, and I, along with the other mother who was 2 seats down from me, and another mother who was in the back row with sort of a teenage boy. Do you see that boy? There were 3 of them. All of them got up and took their kids out of the room straight away, because we all knew that something serious was happening and nobody wanted their children to be there to see whatever it was. So then I came back into the room. I sat Charlie down outside. I came back into the room to see what was going on, and by that stage Mark was there checking the guy's pulse, and I saw Mark, you know, he was sort of touching his chest, trying to sort of, he was very gentle, very slow moving, sort of one of those slow motion type of, he was doing things quickly but very gently and very, I can't explain it, but energetically very slowly, just, you know, are you there, just that kind of thing. And I think it became very clear in one moment to Mark, in my mind, that it was very serious when he was checking his pulses in the different places, couldn't find anything, and I just, same as Sam, I saw Mark's face sort of go, shit, on the inside. And that's when he stood up, and I guess, I don't know, Mark can confirm this, but I guess that's when Mark thought, okay, now it's time for me to do something. And he went behind the guy very gently, lifted his head up, as Rob said, very gently, felt his neck, and I just watched Mark connect with whatever he was feeling very gently. There was no osseous adjustment. It was just a very gentle, energetic input. And I watched Mark close his eyes, I watched him connect, and I watched the moment that it happened. And I think there was maybe like a small energetic thrust. Would I be right in saying that? Like just a small I felt that very moment that he did that, and the guy sat up and opened his eyes. I'm not kidding, it happened in the same second. And I know that Robert explained all the other more, you know, like detailed parts of it, but to me, that part of it was just that split second that, you know, as Rob said, it only took 10 seconds. If it hadn't worked, you know, the next precaution would have been taken. In the meantime, somebody had already called an ambulance. They were already on their way. There was no, you know, there was nothing else that could have been done, and it was the best course of action and the most appropriate course of action at the time, and it worked. So
there is the timing of it means that there is absolutely no doubt in my mind that whatever thrust you delivered and him arousing were connected.
absolutely.
It was instant, you know, like the instantaneous nature of it was like the two things.
And the funny thing of
Whatever the mechanics of that, the physiology of that was, however it worked, those two things were connected.
And I find the funny thing watching on Facebook right now and the amount of banter this situation has created. We don't diagnose things in our way of thinking, but if it was low blood pressure, hypertension, an infarct, or a stroke, or nothing at all, the guy just had fallen asleep, whatever happened in that moment, the chiropractic adjustment and the energetic exchange created a change in his physiology. So we're not here to say that chiropractic cures death, but I think that, but that's where the argument now is being ridiculous.
Yeah.
Everyone now on Facebook is now saying, oh, he must have just had low blood pressure or high blood pressure. That fact in itself means that the adjustment changed the person's physiology and made him healthier in that moment in time. And that's what we say. We often say chiropractic can help people, no matter what the diagnosis is. So I think if we're stopped trying to split hairs over this situation and say, whatever the energetic response was to that adjustment, allow that human being to function at a better state, no matter where he was originally, is the argument.
That's what's so ridiculous, that they're offering all these diagnoses like low blood pressure. The one that's on there this morning is sleep apnea. Like you say, it doesn't matter what happened, the adjustment is what created the change in his state.
Exactly.
And the other, yeah, exactly. Yeah. The other criticism is, you know, why was the adjustment the first intervention? You know, I don't think it was.
No.
The adjustment was not the first intervention. You know, you checked his pulse, you lifted his head to open his airways.
So
Bullshit.
my version, right? Which is,
I think your first response was to soil yourself.
yeah, basically. Okay, so she's like really upset, and everybody clears out, and I went to it, and I don't know if I was in front of him first. Was I in front of him first, or did I go straight? So I went in front of him first. And I'm talking to him, and then I think I went behind him, and the wife is freaking out, and I'm like, it's okay, it's okay, it's okay. And then I took his pulse on his right wrist, and there's like nothing there. And then I put it on his neck, and there's nothing there, and he's not breathing, and he's slumped down in the chair. And so I just got back from India like 10 days ago, or whatever it was, and I'm doing these seated cervical adjustments, totally innately connected, and I'm in that space, and so I took this pulse, then this pulse, and then I tried to take this pulse again, and his arm just went boom, like this, down in between the chairs. I'm like, oh fuck, this is not good. And then I think I gotta adjust this guy, and I wanted to do one of these adjustments, and I was scared to in front of all these people. And so I'm behind him, I have my hand on his forehead, I had my hand on his chest, I left hand on his forehead, I'm sitting around on this side of his head, I got my other hand on his chest, and I stood back up, and then I went, and I'm touching his atlas, and I went like 3 times like this on the right, and sort of took a small breath, and then he took a big breath, and that's when I'm like, okay, it's all right, it's all right. And then he sort of, you know, like a little bit of wake up, then a little bit more wake up, and then he woke up. And that's what it was.
What did his atmosphere like?
I actually wasn't feeling, I was impulsing. I wasn't palpating to, it wasn't, it wasn't horribly lateralized. It wasn't anything like that.
Did it move?
Yeah. But like in a palpatory fashion, not in an osseous release fashion.
Like a joint play way?
Yeah, like do, like that, right? And I was scared. And actually, I'd gotten on the phone before. So before that, so between the, so I'm dealing with him, and then I say, call the ambulance. And so somebody in there calls the ambulance, and they hand me the phone, and I asked, they're doing their ambulance thing, right? The emergency people. I'm like, what's his name? So I said, what's your name? He said, Peter. And then the person on the phone says, what's his last name? And he said his last name. And then I just got rid of the phone and gave it back to somebody else. And that other person told the ambulance people that somebody in their 70s had that happen to them. Because then when the ambulance people came later, we were told it was somebody in their 70s. Right? So when he said he was 49, they thought he was crazy because, you know, they thought he was out of it, right? And then the woman that was with him, who we thought was his daughter, was like, no, he's 49, he's 49.
So when he got better, he looked 49. Before that.
Eventually he looked 49.
Yeah. Eventually. Well, like he wasn't like a really old looking guy. He just looked old because of what was happening. Just to clarify.
Yeah.
And so I was definitely prepared for this through the course of the last year and the work that we did with Dispenza in terms of multiple levels of existence, of being, and interaction with those different levels, one, and two, this mission trip that we just did, which was absolutely this on a very pure level, that physical intervention. So basically, it's that physical intervention, just a seated cervical, has unlimited value in and of itself with nothing else attached, that just that has value. That just that is enough, it's good, it's you know, it's changing. That it's not, for me, it's not about us fixing their curves or their posture or their listing or their scan or whatever. And yes, I think the dance that we can do better if we do it over the course of adjustments. That it's easier, in other words, we got to get in there and input some energy in there and help them shift, change, develop, evolve their physiology. That we're helping them on that level. And that it is easier to do that on a more complete basis by seeing them regularly over time. But that doesn't change that it can also happen like that in one adjustment, one visit, one interaction. And I guess the ultimate as a chiropractor, but I'm not there in my head or in my being or in whatever, would be able to do that miracle intervention every time, one time only. I wasn't thinking, I was scared, I wasn't thinking, and I was reverting to the training that I had had, which had been very much reinforced on this mission trip. And that's what we do. We will go back to how we train. So again, and again, it goes back to those people on those forums, right? Whatever you think, you're right. That's it. Whatever you think, you're right. We're right, and they're right. Now, going back to what Rob was saying, They fucking hate us. They hate us. It's not just like they want us gone. They think that we are hurting them, that we're ridiculous, that we're holding them back. So we're seen as a threat. As we see the pharmaceutical industry being a threat to us, they don't see the pharmaceutical industry as a threat to them. They see us as a threat to them. Only thing that group does is vilify other people. In other words, they blame other people for their shortcomings and try and scare people or shame people on the other side. So that's not an attractive philosophy. However, it appeases people's heads. And our educational process is so perverted at this point that it is producing people who are much more in that other direction. Doesn't mean that's where they want to be, doesn't mean that that's where they're most comfortable with. It's just the way they've been trained. So when I went to this guy and I'm doing my thing because that's the training that I'm reverting to, they're going to revert to this training of, when faced with an account of something like what I just did, they're going to say, that's bullshit. What do you mean he died? He didn't fucking die, you know? He was having all these things that I don't even know what the fuck they are, right?
You have to be in that state for more than 5 minutes to be dead.
Yeah, and because somebody else said
dead, because it was only 3 minutes.
Yeah.
Did they really write that? Yeah.
Oh, no, listen, Karina, I'm talking about maybe 1,000 posts. Maybe 1,000. Now, the deal is it's really only about 20 guys. But it's this
less than that.
Maybe 10 guys, but it's this back and forth post, and I'm talking about literally 1,000 entries on this thing, talking about how we're shit and lying to people
and just to illustrate like where they're coming from. The post that's from this morning is why advertise yourself being a vitalist and voluntarily associate yourself with a fringe, because that brings your integrity into disrepute. Tell your tall friends to rein it in, because they will get called out more frequently and will get away with less and less as time goes by.
Which is what is happening in Australia, for instance. Yeah.
My lesson that I took from this, I don't know if some people agree, but for me it wasn't it was amazing what happened, but it wasn't an amazing experience in the sense that I expected that when you adjusted him, he would be good.
Yeah, I wasn't surprised.
Yeah, I don't think any of us were surprised. We were like, okay, that's good. Now,
it was more like a thank God.
Yeah. But
Rather
none of
than
us were like,
oh my God, he woke up.
miracle.
Yeah, it wasn't
It wasn't
I
a
agree,
miracle.
100%.
There's one moment in time, I'm Mark's here, I'm like, fuck Mark, just hit that. And I'm literally thinking, I'm like, Gary, and I'm like, hit it, man. And Mark's sitting there, I'm like, come on, just hit it. And I was like, and you kind of, that's when your face went white. Oh, fuck, Mark's scared here. And that was when
But for me, the lesson was not that, because we were all confident that what you were doing was the right thing, and what you were doing turned out to be the right thing.
I wasn't thinking. It's not that I wasn't confident.
Well, look, here's the point.
But we were
None of us
confident
were
that you
pushing
were
you
doing
out of the way, saying don't touch his neck.
I think it's good that you weren't thinking anyway.
Yeah,
I agree, 100%.
And that it wouldn't have worked. But anyway, my point is that wasn't the bit that was the lesson for me. The lesson for me is what's happened afterwards with all of this ridiculous stuff on Facebook, because it's just confirmed my belief and reignited my drive towards the fact that we just can't sit around doing nothing. We have to be, as you said, we have to be more involved. We have to be pushing what our goals are. I would say our agenda. What is our agenda? We need to be pushing it because it works. It's worthwhile. It's good for the world. It's ethical. It's there's so many good things about it, and the only thing that they're doing is promoting fear and all sorts of things that aren't good for